In the neonatal intensive care unit, or NICU, imaging plays a vital role in monitoring and diagnosing critically ill newborns. Today, we're going to break down the difference between CPT code 76010 and the more common 1 or 2 view chest X-ray, often used in what's informally called a babygram. CPT code 76010 is used for a radiologic exam from nose to rectum, single view, child, typically to look for a foreign body. This is sometimes referred to as a babygram or kittygram when a single X-ray captures the entire body of a child on one film. While it sounds convenient, this code is reserved for specific situations like when an infant swallows something and the provider needs to check the entire body for its location. In NICU practice, a babygram is usually a one-view chest and abdomen X-ray performed on a newborn. Due to their small size, one image can often capture the heart, lungs, and much of the abdomen. However, unless the image truly spans nose to rectum and is ordered for foreign body detection, it does not meet the criteria for 76010. Instead, most NICU babygrams are coded as 71045, which is a chest X-ray, or any of the other chest CPT codes based on documentation. Why do we do chest and abdomen X-rays in the NICU? There are several clinical reasons: respiratory distress, evaluate lung development, pneumothorax or pneumonia; line placement, confirm endotracheal, NG, or central line positioning; heart evaluation, detects signs of congenital heart defects or PDA; abdominal conditions, check for air fluid levels, obstructions, or necrotizing enterocolitis; device confirmation, ensure medical devices are positioned correctly. Why it's often coded as one view. A NICU chest X-ray is usually coded as one view, 71045, because the infant's small size allows the chest and upper abdomen to appear in one image. It reduces radiation exposure. It's faster and more practical in emergency or bedside settings. If the same film covers both regions, only one technical component is billed. However, the radiologist may provide 2 separate interpretations, one for the chest and one for the abdomen, and bill the professional component for each. However, this is rarely done. Check the policy at your institution on how to proceed with this particular coding situation. Let's look at this report example. Date of birth 10/20/23, age 1 day, order CPT 71045, order exam portable chest 1 view, reason respiratory distress, header portable AP supine babygram. History, respiratory distress, gestational age are available in the medical record. Comparison, none available. Impression, 1 orogastric nasogastric tube, tip projecting at the stomach. 2 for positioning, no focal consolidation, pleural effusion, or pneumothorax was detected. Moderate air distension of loops of bowel throughout the abdomen, technically of indeterminate etiology. Correlation with upcoming meconium passage stooling habits will be of benefit. The radiology report describes a portable AP supine image that includes the chest and abdomen, often referred to informally as a babygram. Despite showing both regions, it's still coded as a one-view chest X-ray, CPT 71045. The image being a single exposure, the primary focus being the chest for line placement and respiratory evaluation, the infant's small size allowing both chest and abdomen to appear in one shot. This is standard NICU protocol, minimizing radiation exposure. Since the patient is a neonate, less than 28 days old, we must follow ICD-10-CM Chapter 16, certain conditions originating in the perinatal period P00 through P96. This chapter is used exclusively for conditions present at birth or arising during the perinatal period, and it takes priority over symptom-based codes like R0600, unless the condition clearly does not originate in the perinatal period. Correct ICD-10-CM code is P. 28.5, respiratory distress of newborn. This code specifically describes nonspecific respiratory distress in neonates and is appropriate when the diagnosis is respiratory distress without a confirmed etiology, such as RDS or pneumonia. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.